All right, so what exactly are we doing when we're remotely monitoring a patient, at least in the physical therapy world, right? Remember, these RTM CPT codes can be applied to speech therapy, respiratory therapy, occupational therapy, and physical therapy. So there's a lot of similarities, but let's talk specifically about like in a physical therapy world, what would you be actually monitoring? What does it look like? Remember, the purpose of this whole program or Medicare's new CPT codes, which essentially is incentivizing us to do a better job at this, is to really pay attention to whether or not your patients are participating with their home program when they're not with you in the clinic, right? And we know that 70% of patients are not participating with their home program. That's not a good number, right? So we want to get that number up. We want it to be flipped. I want 70% of the patients or more actually doing the things that we teach them to do so they get better outcomes. So what is happening? What are we monitoring that is helping them meet that? And that's what Medicare says is you can monitor anything when they're outside of the clinic. You're using a software, digital software program that's transmitting data, but that software can really track and monitor and send data back and forth to the clinic, the remote provider, and from the patient. It's anything that's going to help the patient meet their goals. So in a physical therapy world, that's musculoskeletal pain. It could be balance, right? But typically it's going to be in the musculoskeletal world, right? So anything that helps the patient. Now you think about, gosh, there could be a lot of things. We know a lot of things will help the patient, with a musculoskeletal problem heal. And so let's start with communication, right? Communication is part of this whole program. It's really enhancing communication. So even Medicare has rules with the monitoring codes. The CPT code 98980 and 98981 require a once a month two-way audio communication between the remote provider and the patient outside of patient care time. So it could be on a video, could be a phone call, it could be in person, but it has to be outside of patient care time. So communication is at the heart of this program. So the good news is communication, the time of communication is also counting towards the 20-minute thresholds that produce the CPT codes for the actual monitoring time. So communication between the patient, so when that two-way audio communication, that counts as time. Also, we want to, the Medicare states specifically that the remote provider who's monitoring the patient is also required to be supervised by the in-clinic therapist or the evaluating therapist and then communicate with them if there's any red flags at minimum. But also just communicating, why not all the time, right? Every time I talk to the patient or I do my monitoring, I should be communicating with the supervising therapist, letting them know how that patient is doing when they're not with them, right? So that time also is cumulative and it accounts towards monitoring time. So communication is the key, the heart of this program. Then, of course, when the remote provider is actually monitoring, outside of the communication, they're looking at things that would help the patient meet their goal that they can talk about when they have those communications, right? So think home exercise compliance. Well, what is the home exercise program? In a typical physical therapy setting, it's going to be videos, digital videos or pictures that the physical therapist gave to the patient so that they could practice those movements when they're not with them. But it also could be educational materials, right? You could have educational materials that are teaching the patient about their condition. Um, there could be in my MovementRX, we track pain levels, so the patient is required to report a pain level each day. We also track their steps, their stride lengths, their stairs, so really their mobility each day. So those are data points that we're tracking. We also have our remote providers have access to the EMR system, so they can look at chart notes, they can look at images, evaluations, prescriptions, all the things that would help the remote provider who's not actually caring for the patient, usually, because the physical therapist who is supervising or evaluating is busy. They don't have time to monitor. So this remote provider is really trying to get a full well-rounded understanding of who this patient is and what they're going through so that when they have those communication points at minimum once a month, but also there's chatting features. So our software program has a chatting feature where the patient can chat back and forth with the remote provider all the time. So it really makes sense for them to be reviewing chart notes so that they know who the heck this patient is. But think about from a musculoskeletal standpoint, does nutrition affect healing? Absolutely. Could there be nutritional tracking or education? Absolutely. Does sleep affect the healing? Absolutely. So could this system be tracking sleep? Absolutely. Does stress affect the ability to heal? We know it does, right? So what else does the future hold? I believe that the remote therapeutic monitoring in a musculoskeletal situation right now is at its kind of bare bones. It's new. So you're seeing kind of that first generation is tracking compliance of home exercise movements, right? Exercises. But I think this opens up a whole world for us to be able to track other things, and our system will be doing those things in the future. So that kind of gives you a look of what actually is happening during monitoring. Why are we doing it? What are we monitoring? And what really is the purpose?